Hi, I'm Dr. Thad Deal, and on this video today I want to review with you some basic thyroid physiology and explain why traditional medical management of low thyroid or hypothyroidism fails to help the majority of people suffering from low thyroid function. In response to your body's increased metabolic demands, for instance, you walk outside and it's cold and your body needs to maintain body temperature, there's an area deep within the brain called the hypothalamus. The hypothalamus sends a signal to another area within your brain, the pituitary gland. The signal that the hypothalamus sends to the pituitary is TRH, or thyrotropin releasing hormone. This signals for the pituitary, actually the anterior pituitary, to send a signal to the thyroid gland. The signal it sends is TSH, or thyroid stimulating hormone. If you have a thyroid problem, or if you've ever been checked for a thyroid problem, you're probably familiar with TSH. Unfortunately, oftentimes this is the only test that a doctor looks at. TSH tells the thyroid to take 4 molecules of iodine and 3 molecules of iodine, respectively, and combine them onto a tyrosine backbone to make T4 and T3. It does so with the help of an enzyme called TPO, or thyroid peroxidase. T4 and TSH have an inverse relationship due to a negative feedback loop. In other words, if T4, your thyroid hormone, is low, your TSH will be elevated. And this is how the diagnosis of low thyroid function or hypothyroidism is made. Traditional medical management of low thyroid symptoms involves thyroid replacement hormone, in most cases T4, to increase here to bring your TSH back down to within what they deem a normal range. So this method of thyroid management hasn't really changed much at all since the early 1960s. It's a classic example of the old saying, if all you have for a tool is a hammer, every problem looks like a nail. In this case, T4, or synthetic hormone replacement, is their hammer and TSH is a nail. Unfortunately, the majority of T4, or the majority of thyroid hormone produced at this point, is T4, about 93% to 7% T3. The body uses T3. It's the more biologically active form. So the body needs to convert T4 into T3. About 60% of this occurs in the liver. In order for T4 to travel to the liver, it needs to be bound to a protein. This protein is called TBG, or thyroid binding globulin. It's like the taxi driver that gives a ride to the T4 to the liver for conversion. Conversion in the liver is dependent upon an enzyme called 5'-deiodinase. What this enzyme does is essentially it cleaves one of the iodines off, making T4 into T3. This reaction is dependent upon selenium. Also, there are certain drugs and chemicals which can interfere with the action of 5'-deiodinase. Some T4 is converted into reverse T3, and this is permanently unavailable. This is an inactive form that's unavailable to affect cellular metabolism. Some is converted into intermediate products, T3 acetate and T3 sulfate. These need to be further converted in the gut. So we have T3 here, here, and here. Once it's been converted to a form that your body can use, it travels to the cell where it attaches to a receptor site, influencing cellular metabolism. However, there are things that can affect receptor site sensitivity: inflammation, vitamin A, vitamin D, fatty acid metabolism. So you can see there's a lot more involved than what traditional medicine takes into account. We need good liver function, we need good gut function, we need selenium, iodine, tyrosine, vitamin A, vitamin D, fatty acid metabolism. And chances are, if you're being treated for low thyroid function and aren't seeing an improvement in your symptoms, this approach is inadequate for you. And you can see why. It's a lot more involved in that. On upcoming videos, we're going to identify 6 patterns that the thyroid can malfunction by. We'll also go over what testing needs to be done to properly assess thyroid function. If you would like to discover whether you would qualify for our thyroid recovery program, please call our office at 814-238